Last month, our government announced plans for a phased reopening of businesses and services in Alberta. We followed the evidence in imposing restrictions, and we're going to follow the evidence in lifting them as well. And the reality is that we here in Alberta have flattened the curve. Our number of active cases here in Alberta is low and falling. The number of people in hospital is a tiny fraction of what we were prepared for, and our hospitals are safe, with almost no transmission of the virus to staff, doctors, or patients. On the other hand, the restrictions have a tremendous cost. The cost to businesses, the cost to their employees, and that is obvious, I think, to all Albertans. But we also need to think about the cost to patients from restricting health care. People need care. They were already waiting too long for a lot of the scheduled care before the pandemic. And what worries me even more is that some people may have avoided or delayed coming in when they needed urgent or emergency care. God forbid someone had chest pain or unexplained headaches in the past couple of months, and they were too scared to call 911 or to see their doctor or earn some or come to the emerge. And they didn't get the care that they needed in time. Now, it's happened in other places. It's probably happening here in Alberta, and we need to avoid it happening anymore. We made the right decisions based on the evidence, and I'm incredibly proud of the health system and the way that all of our health professionals in the province have responded to the pandemic. But it's time to get the system working again and show people that healthcare is safe. Now, we recognize that as the province relaunches and we all adapt to our new normal, we all may sometimes find ourselves in situations where physical distancing may not be possible. And, for example, riding transit in the province or shopping, maybe situations where it may be difficult to maintain 2 meters between people at all times. Now, in these situations, the Chief Medical Officer of Health recommends wearing a non-medical or homemade face mask. And this helps provide an extra level of protection for everybody. Now, wearing a homemade mask or non-medical mask in public is another tool to help prevent the spread of COVID-19 here in Alberta. Mask use is not mandatory, but we would like Albertans to have the option of wearing a mask if they choose. To give everyone that option, our government has ordered 20 million non-medical masks for distribution to Albertans. They've arrived and are being prepared for distribution beginning in early June. The masks are 3-layer non-medical face masks with ear loops intended to filter germs and pollution particles. These non-medical masks are not personal protective equipment. They're not part of the supply of PPE for our healthcare workers and our first responders, just to be clear. But Albertans will be eligible for 4 masks per person. And I actually have a package here and what it will look like for people when they're able to pick these up. So there'll be a package where people will be able to get 4 of these non-medical masks available to them. Now, to assist us with the distribution, we've partnered with A&W, McDonald's Canada, and Tim Hortons. The masks will be free of charge to Albertans, and no purchase will be necessary to be able to obtain them. These restaurants have generously volunteered to distribute the masks at their drive-through locations across Alberta. There are nearly 600 partner drive-thrus in our province. 95% of Albertans live within 10 kilometers of one of these 600. Now, using the drive-thrus for distribution also ensures physical distancing can be maintained because people stay in their vehicles when picking up the masks. For these reasons, masks will only be available at the drive-thrus. Now, we're shipping masks to our partner restaurants as we speak, and we'll have more details to share, including the official distribution launch date, once everything is in place and ready to go. We're also finalizing a distribution plan to target higher-risk areas, such as transit and places of worship where physical distancing is going to be more difficult for Albertans. More details will be available in the next few weeks. In the meantime, I encourage all Albertans to source their own supply of non-medical masks from local retailers, or to consider using a homemade mask when they're out in their community if physical distancing in particular is not available to them. Our government cannot supply Albertans with unlimited masks. This allotment of 4 masks should be considered a supplement to store-bought or homemade masks for Albertans.